Thank you for joining us today. We'll be starting very shortly. We're going to give some time to some more people to join us, and we'll be back in just a moment. Good afternoon, everyone. My name is Sarah Shoemaker, physical therapist and assistant clinical director of Spears Tribeca 95 Chambers Street location. I'd like to welcome back those of you who have attended one of our other webinars, as well as welcome those of you who are joining for the first time. We appreciate you taking the time out of your busy days to learn with us. For those of you who do not know who we are, Spear is a private outpatient practice that has been around for over 20 years. We currently have 21 locations all over the New York City area. We have successfully continued to offer in-person care through the COVID-19 pandemic, along with launching Spear Live for those of you who are looking to stay in and receive care using our telehealth platform from the comfort of your own home. In our clinics, we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone. You can find more detailed information on those safety measures by visiting our website at spearcenter.com. We are here for you in whichever way makes you feel most comfortable. If you are looking for individualized care, either in the clinic or through telehealth, please reach out to us at your convenience and we'll get you set up for an appointment right away. We're excited to have you with us today to discuss neck pain and tension. We'll be discussing the anatomy of the neck, some common neck issues, review a few exercises you can do at home as well. If you feel you are experiencing any neck tension, we recommend that treatment recommendations and the role of PT plays into getting you back to life. As you can see, we are coming to you live from various Spear locations, and although we do not anticipate any technical issues today, please be patient with us should any arise as we navigate working through all of this technology. Throughout the webinar, we want to hear from you. If you have any questions, feel free to let us know your thoughts in the Q&A feature. To find where that is, please take a moment to hover your mouse at the bottom of your screen. You will see a Q&A option pop up. That is where you'll put your questions, and we'll do our best to address as many of them as we can during this webinar. It is best to put questions in the Q&A. If you put questions in the chat feature, we will likely be unable to get to them during this webinar. For those of you watching through YouTube Live, we are monitoring the comment section there as well, so please feel free to type your questions in. Lastly, there will be times where multiple panelists will be on the screen. For the best viewing experience, please select Gallery View at the top right corner of your Zoom screen, as you'll be able to see all multiple panelists at one time. So let's talk more about the goals for today, what we'll be covering. So we're going to be discussing what neck pain is, some common causes of neck pain, and then go through some common physical therapy exercises for you all to do at home. Before we get started, I'd like to introduce our team of panelists. We're going to welcome everyone onto the screen now. Our panelists and presenters for today are Colby Choi and Ryan Pena. Colby is a physical therapist at our Midtown West 44th Street location. Hey, Colby.
Hey.
Ryan Pena is a physical therapist at our Tribeca 95 Chamber Street location. Hey, Ryan.
How's it going, Sarah?
And lastly, we have John Bernfeld, physical therapist and assistant clinical director at our Midtown Penn Plaza location. He'll be helping us with answering your questions in the Q&A today. Just as a reminder to everyone, it is best to be in gallery view so you can see everyone at the same time. If you've done that, you should be able to see all four of us right now. So let's get started. John, Ryan, and I are going to say goodbye for now. Colby, we'll let you take it away.
Thank you, Sarah. And thank you for joining, everyone. As mentioned, my name is Colby, and I'm a physical therapist at Spears Midtown West 44th Street Clinic. Ryan and I are super excited that you're here for this presentation today. So let's get right into it. Let's discuss the basic anatomy of the neck. So first off, there are 7 vertebrae or bones that make up your cervical spine, which is just the fancy word for your neck. Then there are nerves that come out from the hole created when 2 vertebrae are stacked on top of each other. These nerves then run down to innervate different muscles in your neck, shoulders, elbows, and hands. Now that we have a better understanding of what makes up the neck, let's talk about the most common types of neck pain. So the most common form of neck pain that I've noticed in the clinic are people who have been working from home throughout the pandemic and have become very stiff in the back of their neck, upper back, and shoulders. Some of these patients have also been having what we PTs refer to as cervicogenic headaches. This type of headache starts at the base of your skull and then wraps all the way around over your head, almost like a helmet, and then it finally ends around your eyebrows. So I found that a forward head posture and then rounded shoulders tend to accompany these symptoms. Since the pandemic began, many of us have been working at homemade workstations that may not have the best ergonomic design, which Ryan will talk about a little later. Couple this with the fact that we're constantly on our smartphones, and I've noticed that more often than not, these patients have developed muscular imbalances that contribute to their symptoms. So what should you do about this? My first suggestion is always to take more posture breaks during the day. How often? I found that people have had the most success when they take a break every hour. Whether it's getting up to get water, going to the bathroom, or just walking around your apartment, movement truly is medicine here. I'm going to personally challenge you to pick a day this week to set a reminder to take these breaks every hour and just see how much better you end up feeling at the end of the day. So while you set up that reminder in your phone or computer, let's talk about some exercises that will help to strengthen your neck. I'm gonna invite Ryan on the screen to help me demonstrate these. Hey, Ryan.
How's it going, Colby? Let's do this.
Let's do it. All right, so the first exercise is called a chin tuck. So without tilting your nose down, pull your chin towards the middle of your neck, where your Adam's apple would be, and hold this position for about 2 to 3 seconds. when you're holding it for 2 to 3 seconds, relax. Perform this about 15 times. Perfect. This is a great exercise to do with your mask on too. It definitely hides the double chin. If you're feeling really ambitious, you can tuck your chin, and while you're keeping your chin tucked, you can rotate your head as far as you can, comfortably go to the right and to the left. Repeat this motion, and feel free to relax your neck between repetitions. Perfect. The next exercises are going to be stretches. The first one we're going to do is going to stretch our upper trapezius muscle, which just runs along the side of our neck and down to our shoulder. Bring your ear to your shoulder, take your arm, and gently pull your head a little further down towards the top of your shoulder until you feel a stretch on the opposite side of your neck. See if you can hold this position for about 20 to 30 seconds. And then after that, so say 20 to 30 seconds have gone by, you'll switch. You can try the other side.
Colby, something I like to do with this one too, with this other arm that you don't have with your on your head. Sometimes what I've noticed in the clinic that some patients, as they kind of pull their head down to one side, they'll end up shrugging the shoulder up and they'll miss the stretch. Sometimes what I do is I have them take this hand, and actually if you just sit on that, you just sit on your hand right there between your butt and the chair, then you pull that head over, you're actually able to kind of anchor that shoulder down a bit. And then when you pull, you can definitely get that stretch a little easier. I love giving that one out.
I love that. Definitely try to do that too. So you can actually use that same technique for the next stretch we're going to do. It's going to stretch a muscle called our levator scapula. So that one runs very close to the upper trapezius muscle, except you just have to turn your head in a different way to really hit that muscle. So what Ryan's going to do is he's going to tilt his head down towards his armpit. Now with the arm, he's going to gently push his nose closer to his armpit until he feels a stretch in the back of his neck. We're going to also hold this stretch again, 20 to 30 seconds, gently. You don't have to be pushing all the way, 110% here. It's a very light stretch. So what Ryan can do is after this, he'll relax his head, and then you can go to the other side. Feel free to repeat these stretches 1 to 2 more times until you feel a little looser. As always with any of these exercises, if you're starting to get any sharp pains, any new pains, just stop for now. Try to lessen the amount of pressure you're putting on. If it's still not going away, then I'd suggest at that point, maybe go into one of our clinics and just get seen by one of our physical therapists. For the last exercise, I want you to keep your elbows tucked at a 90-degree angle next to your sides. Ryan's going to get up to show you this one. With your palms facing up, move your forearms out to the side and squeeze your shoulder blades together. When you're doing this exercise, try to avoid shrugging your shoulder blades. A lot of times people, as a compensation, they'll bring those shoulders all the way up to their ears. So avoid doing that. When you're doing this, perform two sets of 10 repetitions. You can also do this exercise with a resistance band if you have one at home. I think Ryan has one right here. So same position, palms facing up, elbows tucked into the side the whole time. He's going to pull that band apart, hold it for a second or two, and then slowly bring it back. And perfect, and we'll see it from the back. Nice, and see how he's squeezing his shoulder blades together? That's really the important part of this. Great. Again, if you missed any of these exercises, this video will be viewable on YouTube later, and we're going to send you a copy of all these exercises after the webinar. I'm going to invite Ryan to take the mic now and give you some ergonomic tips for working in the office or from home that can help decrease neck tension and pain.
All right, thank you, Colby. So as Colby mentioned here, one of the major reasons we commonly see neck pain here in the clinic is often due to that forward head posture, those rounded shoulders, super common more and more these days as people are working from home, not really having the best work setup either in the office or at their home office. So often, especially since the pandemic began, we've been seeing loads of patients coming in with these complaints of neck pain for seemingly no reason at all. And then commonly we always ask, okay, well, what does your work setup look like? What does your desk look like at home? And we usually hear, well, I work from my kitchen table. I switch between my couch and my bed. Worst of all, the worst one I ever hear, I just sit on the floor and I usually use my coffee table as my desk. That one immediately just kind of gets our blood boiling a bit, but it immediately is something that we know that we can help with. So a reason that we're kind of talking about this a bit is because it is so common, and it is something that we know that we can kind of help you guys through this webinar address independently at home without necessarily having to come in and see us. So we want to cover kind of the basics of a good desk setup and define what good ergonomics are. So first things first, we want to cover what is ergonomics. What does that mean? So usually you hear that word when you're in the workplace and thrown around when people are talking about furniture. Ergonomics refers to the study of people's efficiency in their working environment. So the goals of ergonomics is to prevent musculoskeletal disorders and injuries, increase comfort, increase in efficiency and productivity, and improve quality of life. All of our working environments are always going to be a little bit different. Nobody really works in the same working kind of workspace. So creating the right ergonomic setup for you is going to be a little different, a little bit more personalized. Because of that reason, we're going to make today's presentation about this a little bit more general. So kind of just, these are basic guidelines, don't take anything to super important here. So why do we need a good ergonomic setup? The simple answer, and this is kind of why we're tying this into this neck pain and tension presentation here, there are big consequences to not having a good ergonomic setup or a poor workstation setup. Those immediate consequences and kind of appear as overuse of certain musculature, some fatigue, and commonly some pain. More long-term of having that poor work setup, we often see chronic, tight muscles, weak muscles, people are less productive at work, long-term pain, and really just decreased participation in the things that they like doing most. So before we get started on a proper ergonomic setup, I want to again emphasize not one perfect position is going to be perfect for everyone. As Colby mentioned, kind of movement is key. You want to always stay moving throughout your workday. That's definitely going to help prevent neck pain. If you're staying in any position for too long, it's ultimately going to kind of result in pain. So you want to just keep your day a little bit more variable. You should be, walking around, grabbing a drink of water, grab a light snack throughout your workday. Or if you're not working at all, always just changing your position, not staying stagnant for too long. Today, we're going to show you a good position to try to maintain for a good ergonomic setup, but that'll also kind of help prevent neck pain before it starts. But change of position is going to be great overall. And again, as Colby mentioned, if you're currently experiencing neck pain that you feel might be due to poor posture or ergonomic setup, hopefully these tips kind of help a bit, but also we recommend you can schedule an appointment at any of our Spear locations to talk about your ergonomic setup and some of that neck pain you might be experiencing. So with that, I'm going to bring up Spear's guidelines for a good ergonomic setup. We're going to go through these pretty briefly, and then later I'm going to bring Colby on. We're going go through them in a bit more detail. On these guidelines, I also have some things talking about like seat height, seat depth. Those are definitely going to contribute to more issues that can be seen in low back pain or maybe some hip pain. We're going to more focus today on the upper half, on those shoulders and neck, just because given the focus of today's webinar, but we'll run through everything a little briefly. So seat height, we'll take it from the top. We want the knees at the same height as the hips, so you don't want that seat leaning too far forward or arched back too much. You want kind of everything at that nice flat level. You want your feet supported flat on the floor, or if the seat is too high, you want to then give yourself something to lift those feet up so that they are rested flat. If your feet are dangling, that can often lead to a little bit too much pressure on the legs. Seat depth, so how far back you sit in that chair. So 1 fist distance, or 2 to 4 inches, give or take, between the back of your knee and the edge of that seat. So you never want to have the back of your leg directly driving into that seat. You want to have a little bit of a gap there. Vice versa, you also don't want to be on the edge of your seat too much. That can often result in low back pain if you're really resting your back on the edge of the chair. Seat back, you want a mild curve in the back just to kind of help support the normal back curvature, make sure we're not rounding our back too much. Getting more to our neck portion and kind of really what the meat of this presentation, the armrest. Armrest has a huge kind of function as far as keeping our shoulders nice and neutral and keeping our head in its correct position. You want your armrest to equal height on the left and right, obviously. You want those guys parallel to the floor, so not arching up or down. They should not prevent getting closer to the desk at all. So you want those guys either low enough or high enough where they can go over the desk or underneath. And you want about a 90-degree bend in the elbow, and we'll go into that in a little bit of detail with Colby. Next, we'll go into the desk guidelines. So I'll go ahead and switch slides here. This one will be a little bit more relevant as far as for neck pain and everything. Again, I'm going to run through these relatively quickly. For the keyboard, you want that positioned about elbow height, with those elbows again at about 90-degree angle, and we'll go over that kind of specific numbers in a minute. You want that either flat or slightly tilted away. You don't want to anchor your wrists on the edge of the desk or on any sort of surface. You want to keep those in a neutral alignment, and we'll talk about that neutral alignment in just a moment. Mouse, you want position at elbow height, place elbows at about 90-degree angle. Right next to the keyboard is ideal. You want to avoid any wrist palms and rests, putting additional kind of stress right on those, right on the wrist there. And avoiding any excessive gripping, keep wrists in neutral alignment, which we'll talk about that alignment. Monitor, you want about an arm's length distance away, so about 18 to 26 inches. So if you extend that arm out right in front of you, that's about how far away that monitor should be. You don't want it too close, but also you don't want to be straining your neck if that monitor is too far away from you. You also want it placed directly behind the keyboard and mouse, and the top of that screen should be about at eye level. So again, this is just a brief overview. I'm going to invite Colby back on now, and we're going to go over through these guidelines in a little bit more detail and kind of go through it together. Again, all this info is available on our website. Now that I have Colby on screen, you can kind of see he's got a bit of a desk set up there. We'll kind of go through things in a little bit more detail. So first things first, we'll kind of look at Colby's setup here. Colby has his armrest so he's able to rest his arms by his side. Brought slightly forward, resting on the table in front of us. You can kind of bring those arms forward a little bit if you need. One thing that you want to avoid for sure is having your arms either extended too far forward, or you don't want your chair too far forward where your elbows are going to be bent. Sometimes if we have too much bend in that elbow, we can often compress a nerve that's kind of behind that elbow. And then we can often sometimes get some of that numbness and tingling down into our fingers. I bring that up just because one of the major reasons, one of the common issues we see with people with neck pain that they don't always know is related to neck pain. Neck pain can often be seen as something coming down into your arms. It's very, very common. As Colby mentioned earlier, we have a lot of nerves exiting from our neck. And if we do have some sort of neck pain, we can often see those symptoms down into our hand. And they can present as numbness, tingling, burning, pins and needles. It really can have a variety of different presentations. Again, this is not an uncommon sensation felt in patients we see all the time in our clinics. But if you are feeling those symptoms during your day-to-day activities, we definitely recommend you coming in to one of our clinics in order to better understand what's causing those symptoms and to ensure they don't worsen with any exercises we give you today or with any activities you're doing on a day-to-day basis. With that, we'll move right along. So now let's talk about computer setup. Colby's monitor, you can see it's pretty much directly ahead of him. You want that monitor not too high. You either ideally we want the top of that monitor at eye level or slightly below. So right now, Colby obviously raised his monitor up, so it's at that eye level. You can also notice that Colby is working off a laptop there. So I know we've talked about having your arms at 90-degree angle, having those arms resting on the table. Colby can kind of show you there that, as he brings his arms up, that's obviously not a good ergonomic position. You can see his shoulders are shrugged. He's not resting his arms on the table, which brings up a good point of how can a laptop be ergonomic? I know most of us are working off laptops these days. The short answer is that they cannot. Ergonomics by their design are not going to be something that is going to be ergonomically friendly. But as you can see with what Colby did there, he brought in an external keyboard. He then was able to raise his laptop up on what he has there as like a little laptop raiser. That way he's able to keep himself in a good position, have his monitor at the correct height, and then work off that external laptop. Also, what we see or what we recommend often is getting an external monitor. You can bring the monitor up and then still work off the keyboard off of your laptop. Going through a lot of these things, I think people often get wrapped up as like, what is the perfect desk setup? What do I need to, keep all the time? Especially given, the pandemic. But what Colby and I often kind of say, we want to shift that idea of having the perfect setup and kind of more having, remembering that no one setup is perfect. Colby's obviously in a nice ergonomic chair there, but there are plenty of chairs out there that are going to help support arms, shoulders, neck, and make sure that you're not increasing pain on the neck and shoulders, not increasing tension. So don't think that you need to get a perfect chair or get a new desk or even get a laptop raiser in order to make sure that you're avoiding that neck pain. There's a lot of different ways that you can do that. And most of the time, it's just through staying out of a static position. You want to keep your movement going, and that will prevent you from growing tension in those muscles of your neck, in the upper shoulders that can often cause pain. Also, we wanted to talk about briefly, I know we commonly see standing desks here in the clinic. Colby actually there was able to make a makeshift standing desk. He used a couple of boxes. He also has that razor there. He'll just move his laptop right up there. Again, you'll notice in this position, Colby's not able to really rest his arms. He's got his arms brought up a little high. Again, this highlights the fact that laptops themselves are not ergonomic just by their nature, but that's okay. Again, idea here is that Colby is switching positions. He's going from a seated position, standing position. He might stay up there for about 30 minutes, then move back down to the chair. By doing this kind of fluctuating positioning, he's avoiding keeping any sort of increased tension here. He's not staying in this forward head, round shoulder. He's moving around, which is ultimately going to decrease stress on those muscles in the neck and shoulders. All right. If you have any additional questions about ergonomics or the setup that we kind of went over today, obviously, again, we talked a little bit more about the upper body and less about the low back and things like that. You're more than welcome to reach out to Colby or myself directly. You can also schedule an appointment, and all of our therapists are trained in kind of proper ergonomic setups, and they can kind of go over what a good ergonomic setup would mean for you at your home office. But with that, if you have any questions specifically about ergonomics, again, include them at the Q&A down there at the bottom. But with that, I'm going to invite Sarah back in. We're going to start answering some of your guys' questions that are going to be specific about neck pain, so we can kind of get your guys' questions answered here.
Thanks, Ryan and Colby. That was great. So we do have one quick question just to clarify the arm position. When you mentioned arm resting at 90 degrees, can you quickly review how arms should be, where chair should kind of sit?
Yeah, totally. So Colby, if you head on back towards that table, Colby again has kind of a bit of a makeshift desk here. He's using one of the plinths that we have in the clinic. But ideally, Colby is going to have his arms rested by his sides, shoulders not raised at all. And that 90-degree angle is what we're seeing from the top of his shoulder where it meets his elbow and then out towards that wrist. So if Colby was in a smaller than 90-degree angle, he might be a little scooted forward, or that might be, yeah, there you go. Go ahead and show just like what like a 70-degree angle would be, Colby. So if you were like too far up, yeah, so that's kind of crunching down on his elbows and he's kind of over bent there, which we don't want because that kind of that can commonly bring on those nerve symptoms. On the opposite end, if Colby was at more of like 110, 120-degree angle with his elbows, he might be a little bit more extended out in front of him, which ultimately can then, as you can imagine, bring his shoulders forward. He might start to lean forward a little bit more. It's going to overuse those muscles in our neck, in our shoulders, and those can ultimately lead to that neck pain or tension. So that's why we really recommend 90-degree angle. It keeps the shoulders, the elbows in neutral. You're not putting any additional stress on any of the muscles in the shoulders or neck, and it kind of keeps you from using anything that could cause pain. Hope that helps.
Yeah, great. So with that, can you quickly show with the 90 degrees of your elbows and shoulders, can you quickly show where your wrists go kind of on the keyboard?
Yes.
Just to bring the whole chain into.
Putting it all together, definitely. So yeah, ideally, Colby, yeah, go, yeah. Colby, slide a little bit further forward there. And what Colby could essentially do so that he could have his arms fully resting would be moving his monitor back just a little bit. And that way he could slide his, there we go. And then you can kind of see his arms are bent, his elbows bent to 90 degrees. He's able to rest his arms on the armrest there and have his hands on the keyboard.
Great, great. So let's kind of dive back into the neck pain, will the exercises you went over, or are there different ones to do if you have sort of a stiff neck and you have difficulty turning your head, especially after sleeping funny?
That's a great question. That is a great question. Because that's definitely happened to me before. These exercises may help. I would give them a try and see if you find any relief. I do have another exercise that definitely will assist you if you ever have this type of pain where you're sleeping, maybe it's a new pillow, maybe you're sleeping somewhere where you're not usually sleeping, and you just wake up and you just can't turn your head to one side, but the other side feels fine. All you need is a bath towel, a t-shirt, or what I have here is a pillowcase. So what you're going to do is you're going to take the pillowcase, you're going to drape it around your neck, then you're going to cross your hands. What we're going to do, so we're going to turn to the left first, and we're going to stretch our left side. So we're going to take the right side of the pillowcase, towel, whatever it is, and you're going to wrap it around your cheeks, and you're going to turn your head towards the left. What I'm doing here is I'm giving a gentle pull on the towel to assist my neck as I turn. Okay? So again, this is to the left. You're going to turn your head to the left. You're going to take the towel, pillowcase, whatever it is, and assist with turning your head. Gentle stretch. Hold it about 5 seconds. Repeat about 10 times, and then you can switch to the other side. Turn. Same idea. Gentle here. If for some reason, after all this, it's either getting worse, if it starts getting worse, just stop the exercise right there. But if the symptoms still persist, then you could definitely schedule an appointment or an evaluation at one of our clinics, and one of the PTs could definitely help you out.
Awesome. Do you have any recommendations for pillows or neck positions with sleeping?
That is a good question. So generally speaking, you want something that's going to be firm enough that it will support your neck, kind of something that we've been talking about with the ergonomics, that's going to keep you in a neutral position. Let's say I have something that's very, very soft and doesn't really support my head. If I'm a side sleeper, I have a really soft pillow, and that results in my head tilting. If you're in this position for anything, over an hour, just being in a slight kink like this, imagine 8 hours of kind of staying like this. Ultimately, you're going to end up with tight muscles on one side, stretched muscles on the other. You're going to end up and you're going to wake up and kind of be in that position that Colby was talking about, that kind of stiff neck as soon as you wake up in the morning. So to kind of get back to the root of the question, specific pillows or positions, anything that really keeps your head in neutral. So if you are a side sleeper, you might want something a little bit more firm, that when you lie on your side, it's going to keep you in that nice neutral position. If you're lying on the back, you're usually good for most pillows just because you're not going to be able to kind of really get thrown out of that position. But again, side sleepers, I usually recommend something more firm. Back sleepers, I usually say whatever's most comfortable for you. If that's a softer pillow or if it's a firmer pillow, just make sure that you're not in any position that's either going to leave you in a super kinked position one way or another. Keep your head in as neutral of a position as possible, and that will avoid any sort of predicament of ending up with that neck pain when you wake up in the morning. You can see Colby there, he folded a pillow in half, so that kind of was able to prop him up a little bit more. That's something we do in the clinic here as well. Hope that answers that question.
Great. So other than the exercises you went over, we're having a few questions about either heat or like massage. What sort of things do you recommend to help decrease this neck pain?
Colby, you want to take that one, or you want me to just add it down?
Absolutely. So with as far as heat goes, a really great way to just test if heat is going to help your symptoms is if you're going into the shower in the morning, don't turn the heat up all the way, but have a nice stream of hot water going over your neck, your upper back, and see if that helps your symptoms. If that begins to help your symptoms, sometimes it can take away any of the stress, can take away some of the tension in your neck, and it can allow you to do some of or get a little bit more motion. So one of the things to try is some of the exercises we did today, whether it's the chin touch with the rotations, even some of the stretch where you bring your arms up to the side, or even just standing and stretching there while you just have some hot water running over your neck. That can definitely help with some of your pain.
Yeah, and to go off the other kind of bit of that question, also asking about massage. Lots of times we get patients coming in often asking, oh, I have this neck pain. I heard you guys do massage. Is that true? And sometimes massage can help. Here in the clinic, we kind of use a variety of manual therapy techniques. Sometimes that involves, some manual work that we will dig into those tight muscles. Maybe we're pushing on the vertebrae a little bit to kind of increase motion. But that being said, oftentimes those techniques aren't what's going to kind of keep your neck pain at bay. We do those and accompany them with stretches and exercises, because ultimately what's going to make the bigger change in your neck pain is activity and doing things that are going to make those changes sustainable. A day of massage, a good hour-long massage working into those muscles, it probably will feel great, and you might have a good 48 hours of relief. But generally speaking, what's going to give you with those longer-term changes and those benefits are going to be stretching, exercising, and really getting to the root of what is causing your neck pain and kind of working that out instead of just throwing some massage, throwing some heat on it. Those things do feel great, I will admit, and I am a frequent flyer of, getting some massages. But I know that those are not ultimately going to fix any pain that I might be having.
Mm-hmm. Awesome.
Great answer.
Yeah. So going back to those headaches that you talked about in the beginning, Colby, how common are those? We have somebody saying that she experienced them for a week and is now in PT and they have stopped. So can you talk about kind of the progression of them, how often they happen, stuff like that?
Yeah, absolutely. So if you're getting those types of headaches where they're caused because of what I was mentioning before, that forward head posture, where your head and your neck are kind of falling forward, just being at work all day, there's a muscle kind of right at the base of your skull. A lot of times when that muscle gets really, really, really tight back there, what happens is it starts to, what we call referred pain, and it can create that sensation of a headache. And that's that, it feels like a helmet. It goes to your eyes. A lot of times in PT is we loosen that muscle up, we follow it up with some exercise, and it basically keeps that muscle loose. So we have to retrain that muscle to kind of stay here. So instead of our head being forward all day, it's going to retrain you to be a little bit more upright. It takes the pressure off that muscle in the back, and generally headaches will stay away. Now, the key is to make sure that you're, at home, you're taking your posture breaks, you're trying your best to have a great ergonomic setup, and just, keeping up with the PT exercises that you might be given with your PT. And generally the headaches will stay away. There are other different types of headaches that a PT would definitely be able to help differentiate with you, but it's always good to just check in, because a PT will be able to know whether, that headache is coming from your muscles or if it could be migraines or some other type of headache.
Great. We have a few questions regarding exercises to strengthen the neck muscles. How can you kind of elaborate there?
That's a very good question. One of the main exercises that we all do frequently in the clinic is the one that Colby covered, that chin tuck. Definitely was a very basic level of that exercise. Again, we kind of just cover it again, just bringing that neck back. It kind of also combats what Colby was just talking about, strengthens the muscles in the front, helps loosen those ones in the back so that we kind of pull ourselves out of that position. In addition to that, there are a number of other exercises that we use here in the clinic to strengthen specific muscles in the neck. That being said, sometimes people have neck pain and they're like, oh, what are the exercises I need to do? They must be weak in my neck. Something's going on. What do I got to strengthen? What's got to get done? Do I need to go to the gym? And it's a very fair point. And in PT, we mostly do focus on, stretches and exercises. But that being said, for some people that come in with neck pain, their focus might not be on strengthening. It might be a more mobility and stretching based approach versus someone else who might be having something common we see are people who kind of move their head over their shoulder and they get those random kinks that, shot up my neck. Sometimes what we often think with those patients, or what kind of after we do an evaluation, leads us to some instability in the neck. In those cases, we often go more of the strengthening route. So it really depends on what your symptoms are and how they're presenting. And that's something that we kind of dig into a little bit more when you come in the clinic. And it helps us differentiate is our plan of care going to be more of a strengthening focus where we kind of really do address those neck muscles and we kind of do a lot of strengthening? Or are you very stiff and you're getting this pain because of tight muscles, really stiff vertebrae that just aren't moving well? We see that commonly in patients that have arthritis in their neck. Their vertebrae are just a little bit more stiff, so they're lacking mobility. And with those patients, we again, focus a little bit more on mobility exercises and stretching. So to kind of get to the root of the question again, just making sure that, you know, I don't want to give away too many exercises and have people strengthening their neck and then ultimately resulting in more pain because now they've got stiff necks from strengthening. If you're having that neck pain, you know, you could try some of these stretches and the exercise, see if they all work for you. But if they don't, definitely, you know, would recommend coming in to see what your neck pain is kind of due to. And that way we can kind of gear that plan of care more towards you and what's causing your neck pain.
Nice. So when your neck is stiff, generally speaking, is it best to ice it, to heat it, or do both?
Ooh, good question. I'll take this one too.
And with that, it's going to be best to just try it out, see which one feels better. Typically, if you feel like you have a stiff neck, generally heat would feel better. And then when you have more of a sore neck, that's going to be more cold. But at the same time, everybody is a little different. Everybody responds to it a little different. Some people might not even feel any difference between heat or using a cold pack. It's all going to be dependent on the person. What I will say is to be safe when you're doing it is try to make sure that there's at least one, if not two layers between the heat, if you're using a heat pack, and your skin. You don't want to get any burns, and constantly do skin checks. So I would say every 5 minutes, just check your skin, make sure it's not getting too red. And if it starts to hurt too much because it's burning, then just take that off right away. Same idea for the cold. Never put any any ice directly onto the skin. Always make sure that you're wrapping it in a paper towel, a t-shirt, a pillowcase, something so that there's a layer between your skin and the ice so you don't get frostbite. But generally, yeah, try it about 10 minutes and see how it makes you feel. I wouldn't leave it on longer than 10, 20 minutes though, if you are trying this.
Yeah, I would go right on pretty much the same thing that Colby said. I usually, when patients come in and I kind of feel around and I'm feeling some really tight muscles, that's generally when I use heat to kind of relax them a bit and kind of get them to ease up. Vice versa, if I have someone coming in and they just got a lot of pain, ice is really great for just numbing. So just putting an ice pack on. Again, neither of these are going to be something that's going to cure your neck pain long term, but they are definitely something that if you're experiencing higher levels of neck pain, that you're kind of having a tough time getting through your day-to-day activity, trying those modalities like heat and ice are going to be great options, just to kind of lower the pain levels until, you know, you're able to do something or come into the clinic to kind of more permanently reduce that neck pain.
Awesome. We have a few questions about use of traction. Can you guys kind of talk about what that is and how, if it is used in the clinic?
Yeah, totally. So traction, kind of going back a little bit to Colby's anatomy kind of overview that he did. As he mentioned, all the vertebrae are going to be stacked on top of each other. And between each vertebrae, you're going to have some nerves that are going to be exiting out. What traction does, and for those of you who might be in the webinar here that don't know what traction is, essentially traction is going to be helping separate those joints a little bit. Nothing painful. Traction that we do here in the clinic is never meant to be painful. And if it is painful, we usually cut it immediately. But generally speaking, traction is a form of therapeutic exercise that we do that gently separates those vertebrae. And what can temporarily do is if you're having any sort of nerve pain coming down up into your shoulder, up into the arm, it will separate those vertebrae in a way that it might offload any of the tension that may be pressed on some of those nerves. So it is something that we do here in the clinic. It again is on a case-by-case basis. You know, if somebody is coming in with what we think might be nerve pain related to an issue, at the neck, that is definitely a technique that we use. We can do it manually with our hands. Some clinics have machines that are able to kind of help create that kind of traction at the neck. But again, something that we typically use with patients that we're seeing some referred pain down the arm. Sometimes they get numbness and tingling in the fingers. We'll often try traction as a method to help decrease that nerve pain down into those arms. But again, on a case-by-case basis, not everyone requires traction. Some people don't do well with it. So we usually kind of wait and see how patients respond to it here in the clinic.
Absolutely. And just to add, I agree with everything. And just to add on to that, I've had some patients come in and they've had these home traction machines where you hook it up to a door, you put it around your neck and it pulls up on your neck. In those situations, I think it's always best to go into the clinic, just make sure that that's actually going to help you, and see if the PT can bring it in with you, see if the PT can help you set it up. That way at home, if you do feel like, and the PT agrees that maybe this would help you at home, at least you have somebody that's trained in setting it up. But I would not try it by yourself immediately. I would always go to seek help and maybe just make sure that it is the right thing for you before you start using it and going crazy with it.
Definitely.
Awesome. But great point, Colby. We have a question. It's a bit of a specific diagnosis, but can you elaborate on what cervical dystonia is? I know it's a very generic term that is kind of thrown out there, and if the exercises you went over would help with it.
Yes, definitely. So cervical dystonia, that is one that often, if you go into your doctor's office and you're having neck pain, a lot of the times they might give you a script for PT and they might just say, yep, you've got some cervical dystonia, go out and see a PT, and they'll kind of be able to take care of you. Cervical dystonia, for, just to put it in layman's terms, it really just means an irregular amount of tension in your neck muscles. So certain muscles in your neck, maybe on one side, maybe in the front, maybe in the back, are going to be slightly more taut and have that tension, whereas other muscles in your neck are going to be a little bit more lax, a little bit less tight. And oftentimes, whether it's on side to side, that can often give you a pain. It can also kind of give you maybe a slewed posture kind of in your neck. You can maybe have we often see cervical dystonia with tight muscles in the back, which end up, again, I know a phrase you've been saying a lot, that forward head posture. You can have really tight muscles in the back, which are going to ultimately kind of scrunch the back, really loose muscles in the front, which are then going to not hold you back here. So often doctors will use that phrase, cervical dystonia, and really it just means that you have some tight muscles in your neck that often need to be addressed. What we went over in the lecture today, or in the webinar today, definitely can help. It really ultimately is going to depend on where your muscles are tight and where they are weak. I would give all of the exercises if somebody came in and, just generally speaking, somebody who had cervical dystonia, without knowing too much other information, I could say you could try all the exercises we did today, see how they feel, give them a try. I wouldn't say that, a lot of time with stretches, you're not going to get that immediate relief. It does take some time to really notice the changes over time, but definitely give them a try, see how they feel. As long as they're not causing you increased pain, they're probably helping. If you don't notice change over a week or two, it might be something else that you might need, in which case I would recommend coming into one of our clinics. But definitely give the exercises from today a try if you're someone who's dealing with cervical dystonia.
Couldn't agree more.
Nice. Here's a good one. Should we try to stretch until we feel pain? Is it good or bad to stretch enough to feel the pain?
Yes.
Great question.
There's a common saying, no pain, no gain. That is not the situation here. When we're doing these stretches, what we like to do is long holds, but very low load. So when I'm stretching here, I'm not cranking on my neck until I feel really sharp. If you were to put it on a scale of 0 to 10, 8 out of 10 pain. I'm not trying to get my neck to feel super painful. It never should feel that way. No stretch, no exercise should ever feel, that torturous for the most part. Now, when you're bringing your head to the side here, it should feel like a very gentle stretch. The biggest part is the long holds. So that 20 to 30 second hold, what you're doing is you're basically stretching the muscle fibers and you're holding it for that long. If you only hold it for about, 5 seconds, 4 seconds, what's actually happening is you're feeling that benefit of the stretch. You're stretching these muscle fibers, but then, over the course of the day, they just go right back. When you do that light hold it for 20 to 30 seconds, the muscles are stretching and they're holding and they're staying that way. And then from there, they basically relearn and you're reteaching the muscles to stay in a certain position. Now, the other key with this is you can stretch and stretch and stretch and stretch all day, but if you're not doing any new muscle education or strengthening after you stretch, a lot of times those muscles, again, they just go right back and they become tight again. So always make sure you're trying some exercising after you do any of the stretching, and the exercise we did today would be perfect to do.
Yeah, and to totally just kind of go right off what Colby said. I mean, I often give patients the exact kind of explanation of those stretches that we did. But for some patients that come in and they have really tight musculature in their neck, sometimes I won't even have them use their hand. I'll have them sit on one side if I'm stretching their left side here, and I'll say, drop your right ear towards your right shoulder. If they drop this down and they're already feeling a good pull, there's no need at that point to then force yourself into a further stretch. If you can just drop your head down and feel a stretch just like that, that is perfectly fine. Again, like Colby said, 30 to 40 seconds of just hanging out here while you're feeling that gentle pulling in that muscle, pain-free, that will be good enough. Now, if this isn't enough for you and you're like, yeah, I'm not really feeling much of anything, that's usually when I have people bring the hand in. Sometimes I even just say, rest that hand on your head. Don't even pull down. Just the weight of your arm resting on your head is enough to get that nice gentle pull. If you're not feeling it, then you can obviously kind of give a little bit more overpressure, but it should be gentle. It should not be painful. No pain, no gain is definitely not the method we take here at Spear.
Great. So questions have died down a bit. So we're gonna wrap things up. So we hope today's talk was valuable for you all, that you learned more about some neck pain, some treatment methods, and different ergonomic modifications to manage and improve your symptoms. If we didn't get to your question, we will do our best to reach out to you directly after this webinar. As a reminder, your presenters for today were Colby Choi and Ryan Pena. Feel free to jot down their contact information so you can reach out to them directly with any questions and or to schedule an appointment.
Thanks for coming, guys. Really appreciate
Everyone.
you.
Yeah. As a reminder, did that already. Their faces are still on the screen. So also we had our Q&A moderator, John Bernfeld, Assistant Director at our Penn Plaza location. And I'm Sarah Shoemaker, Assistant Clinical Director at Tribeca Chambers Street. Feel free to reach out to either of us as well with any questions. And we'd also be very happy to facilitate getting you set up with one of our great therapists throughout the city. At Spear, we do treat an array of conditions from head to toe. And as a reminder, we're open for in-person visits as well as telehealth sessions. Should you feel that you could benefit from some individualized guidance and treatment, please do not hesitate to reach out to any of us individually, and we'll personally coordinate you being set up with one of our team members for an evaluation. Lastly, at Spear, we will be continuing to host these webinars throughout the rest of 2021, covering a variety of topics. We look forward to seeing you there in the future. Please follow us on social media and or check your inboxes to learn more about the upcoming topics and the schedule. Thank you all very much for spending time with us today, and we hope you did enjoy our webinar, and we wish you all the best. Stay well. Bye, guys.